When she was in third grade, they put her in handcuffs and took her to the mental health facility in Riverside County. But once they got there, she had calmed down and she was fine, and they released her immediately to me. She had a meltdown at school, and they proceeded to call an ambulance and take her into the hospital. I met them within probably about 45 minutes or so after they had taken her in. They had her in a room by herself, but there was a policeman set outside her door so that she was being watched constantly. The door was not we weren't able to close the door. When I got in there was nobody who could tell me what they were going to do, what was going to happen. They just said that she had a break at school and they were going to 5150 her, which was a panic for me because I had not been through that before with my granddaughter. Probably 2 shifts of doctors had gone through. They were trying to hospitalize her somewhere in Sacramento. At that point, I said, no, you need to do blood work. We need to find out if her medication's off. Maybe there was a trigger at school. What happened at school? Why did this happen? Nobody could actually tell me what happened. At that point, she'd had no food, no medication, and she had been in the hospital since approximately 10:30 in the morning, and now we were looking at, probably 6, 7 o'clock at night. She didn't know what was going on, and neither did I at that point. Once we got through, probably about 9, 10 o'clock, one of the doctors released her and said, since you're seeing her doctor tomorrow, you can take her home and do that. At which point we tried, and the doctor went home and the other doctor wouldn't release her. So we had another 3 or 4 hours of waiting, no one coming in to tell us what was going on, no one coming in to give her new medications, no blood work was being done, no support at all, just sitting there waiting and watching her go through her cycles of being bipolar. So it was pretty stressful and heartbreaking to watch it because we thought they were going to take her away. She's doing well. She's gotten a lot of support. She's gotten a lot of coping skills. She was able to go through a few programs which supported her and her needs. Because I am an advocate, I know what's out there and what's available for her and what she needs. Parents who aren't advocates and don't know what's available to them aren't getting those services that they need for their kids because they don't know what to ask for.